us to our speaker, health activist Alicia Staley.
Thank you very much, Amanda. We're going to get started now. Hi, everybody out there in webinar land. Thanks for coming to my webinar this evening. And I'm going to share with you a little bit of my journey on how I ended up becoming a health activist. Obviously, from Amanda's introduction, you know that I'm a 3-time cancer survivor. And I just want to give you a little history of my cancer journey, and that might actually fill in some of the gaps as to why I ended up heading toward the health activist field, if you will. But in 1991, when I was a sophomore in college, I was diagnosed with Hodgkin's disease, which is a cancer of the lymphatic system. I was actually diagnosed as stage 2A and had radiation and surgery to deal with the Hodgkin's initially. After I had finished the radiation treatments, within about 9 months I actually had a relapse. The Hodgkin's came back, and I at that point needed additional surgery and more chemotherapy. And in total it took about almost 2.5 years for me to get through from my initial diagnosis of the Hodgkin's to the point where I was actually done with treatment for the disease. So it was a tough battle for me as a college student to make my way through all of my college classes and deal with cancer at the same time. I made a decision not to drop out of school, which in hindsight I don't know if that was really the best thing for me to do, but I was determined to make it through my college time without having the cancer really interrupt my studies. It affected things like my ability to go out on Friday nights, but I was able to stay on top of my classwork and get through college. For about the next 10 years, I actually did very, very well in terms of health. Cancer was always in the back of my mind, but I wasn't dealing with day-to-day issues in terms of my cancer diagnosis. In 2004, I had actually been undergoing mammograms on an annual basis because my doctors knew that I was at risk for breast cancer because of the Hodgkin's treatment. And on April Fool's Day in 2004, I was actually had a mammogram that found my initial breast cancer diagnosis. I went through mammocyte radiation at that point and was able to get through the breast cancer fairly quickly. I was amazed at how fast I was able to go through treatment for breast cancer as opposed to Hodgkin's disease. It was very different, and I could tell even 11 years out from my last Hodgkin's treatment that the world of medicine had changed dramatically in those years that I wasn't dealing with cancer on a daily basis. 2004, 2005, I seemed to do fairly well getting through the breast cancer diagnosis. In 2006, actually, I went through a great deal of issues with tamoxifen and made the decision to go off the drug at that time. And then in 2007, I was actually diagnosed with a second breast cancer. And I call it a second breast cancer as opposed to a recurrence because it was actually a second entirely different breast cancer than the first breast cancer that I had. So I was really dealing with a new cancer diagnosis. At that point, we realized that I had already had radiation. I had had surgery. There was really nothing left for me to do at this point other than try a double mastectomy, which I did in January of 2008. Went through the double mastectomy, had no reconstruction, and basically done very well in terms of managing the breast cancer since that point. Last year I actually had an ovarian cancer scare when I was going through my annual checkups from last year. They found a spot in my abdominal region that really caused some concern and really scared me quite a bit because I thought I was dealing now with an even new kind of another cancer. So my cancer plate has been very full over the last, let's see, almost 19 years. And I've learned a lot from all the times that I've spent in the hospital, dealing with doctors and nurses, that there's still a lot of work that needs to be done. And from a patient perspective, I really felt it was time for me to step back into this world, in the cancer world, and do what I can to help others. So you'll see on the bottom of my slides, I write, it's time to help others, and that's really sort of the motto that I've taken on over the years as I've progressed through my journey. And I've noticed that there's a couple ways to look at this. There's the offline world and the online world in terms of activism. And I want to just give you a quick overview of what I've done in the offline world, if you will, just in terms of dealing with the cancer population and being a patient advocate. But in 1995, I actually had my first opportunity to become a patient peer with a group at the University of Rochester in Western New York. I was actually treated in Western New York for my Hodgkin's disease while I was going through school, and the hospital had called me and asked me to be a patient peer. So essentially I was a phone call away from people that were newly diagnosed in terms of Hodgkin's disease. And I figured this is great. I'll start interacting with other patients, try to be a role model, pass along some of the advice, tips, and tricks that I've learned over the years. And I was really surprised that I got maybe 1 or 2 phone calls a year. The program itself wasn't very well publicized, and people just didn't seem to be interacting very well. They weren't connecting very well. And to me, that just seemed unfortunate that there was a person. I had already gone through Hodgkin's disease. I was willing to help other people, but as a resource, it was hard to get the word out, and people just didn't seem to want to take advantage of that. In the back of my mind, I had always thought about starting up my own foundation to address some of these things, that there's a lot of ways that people can step into a healthcare setting. You don't have to be a doctor or nurse to get involved and to support patients in ways that doctors and nurses might not necessarily do. So the wheels got going, and I decided in 2007 I was going to put my money where my mouth is, so to speak, and I started the Staley Foundation, which is based here in Boston, Massachusetts, where I am now. And the Staley Foundation provides education, advocacy, and awareness resources for people that are going through cancer. And it's not necessarily Hodgkin's or breast cancer, it's all kinds of cancer. And what I've tried to do over the years is publicize the Staley Foundation and network with some of the local hospitals here in the Boston area to do what I can to fill in some of these places where the doctors, the nurses, or the healthcare system itself don't take care of patients or don't have the resources to do that, whether it's financial or just emotional support, anything along those lines. In 2008, I actually had the opportunity to start with a group called the National Breast Cancer Coalition, and that is really where I think I've picked up a lot of the ideas of being a health advocate. And that's a really good organization in terms of breast cancer awareness. They've done a lot to train people and educate people on how to be the best breast cancer advocates that they can be. And NBCC for me is really more of an offline, I call them an offline organization because primarily a lot of their work and networking is done face-to-face. They're not really big into the web yet like I am. I would consider myself sort of hyper-connected at this point, but back in 2008, they were still very grassroots level for me, very person-to-person, and they're not quite into the social media space yet, but of course I'm getting ahead of myself a little bit. The other way that I learned to really start developing my offline advocacy is just dealing with my local communities, trying to find out where the needs are in local hospitals or with other nonprofits, just reaching out, making calls, and staying connected with what's going on in my own community. And I've actually I still do quite a bit of outreach for my hometown in Western New York. And I try to support the local hospital there and some of the nonprofits that are there in the region in terms of cancer education. in cancer advocacy. So now we're going to get into the fun stuff for me. But my online journey, I noticed really, I felt like I had feet in both worlds. So I was dealing with offline resources and then online resources at the same time. In 1996, I think I had another big moment in terms of my advocacy awareness, or getting the idea that I could be a health advocate at some point in my life, was in 1996 when I signed up for the ACOR, the long-term survivors listserv, which is cancer survivors that had made their way to this online organization. I signed up for the email, and it was basically a very well-moderated email list where I was learning from some of the older survivors in the group. And when I joined in 1996, I was only 26 years old. So I was really the youngest person in that group, which was, to me, phenomenal that I could meet or I could interact with other survivors who were, in some cases, 20 or 30 years out from their last treatment. And this made me so hopeful. This really, for me, in 1996, really changed the game to a certain perspective for me, because I started seeing that there's long life after cancer. And in my college years, that for me was very hard to wrap my mind around. I didn't know a lot of people that had dealt with Hodgkin's or any cancer for that matter. And to be able to get onto an email listserv where people were talking about what life was like 30 years after their last treatment, to me it was just really inspirational and very eye-opening. And I wanted to figure out a way to take the knowledge that I was learning from these groups and share it with other people. And I struggled for years because I couldn't quite figure out how to make this connection. In 2004, when I was diagnosed with breast cancer, to me, that is really when the idea of becoming a health activist or an advocate really started to take shape. I was on the web all the time searching for information about breast cancer diagnoses after Hodgkin's disease. I found a ton of information, but I struggled because some of the information was really outdated. In most cases, some of the reports that had been produced, you could only access half the report. I sent letters or emails to the different organizations that held on to a lot of this information, asking for access for a patient. Give me information that a patient would want to read. And in most cases, I wasn't allowed to read this information because it was intended for doctors or researchers, which obviously that I didn't fit the bill in most cases. And I got really frustrated with that during that time period. And I ended up emailing a lot of the researchers and doctors that were on these reports directly. And that probably drove the doctors crazy, that they'd have a random person emailing them to ask them a question about line 56 in a report on breast cancer treatment. And I realized there had to be a better way. I was wasting a lot of time, a lot of energy trying what I thought was to look for information that would make me not only physically feel better, but just emotionally, mentally feel better, a little bit more relaxed about everything that I was going through. I was able to get through that time period, but I had a lot of questions about how could this be better. In 2007, I was thrown right back into it again with a second breast cancer diagnosis, and basically repeated a lot of the same mistakes or a lot of the same energy loss that I went through the first time in 2004. I kept looking for information, couldn't find it. I emailed doctors, I'd email researchers, and to me it was a very, very frustrating experience. And it led me to what I like to call my aha moment. I guess I borrow that from Oprah, but I had an aha moment. And for me, it occurred on March 30th, 2008. A lot of people say, oh, were you admitted to the hospital again? And I say, no, actually, I signed up for Twitter. And to me, signing up for Twitter, I did this after having some friends just after me for weeks. They said, you got to sign up for Twitter, you got to sign up for Twitter and search on cancer survivors. And I was very reluctant. I said, you know what, I've gone through everything, I've searched Google, and let me tell you, when I finally did sign up for Twitter and got going, looking for cancer survivors, I was absolutely overwhelmed at how quickly I was connecting. In some cases, I've met other women who had Hodgkin's first and then breast cancer, and to me this was huge because I went years looking for people in situations similar to my own, and within about a week on Twitter, I had more connections than I knew what to do with. It was an eye-opening experience for me, and still to a certain extent. And over the next few weeks, I like to say I went through this thing called a social media explosion. And I found this incredible slide that another person did on social media and what social media was to them. And this is exactly, I think, how my mind was running in the first few weeks after I got on Twitter and started connecting with all these other cancer survivors. It's just, to me, it was this confluence of just events and resources and connections, and it just, to me, it was almost overwhelming. And you can see in the chart that it's exactly what it is. It's an explosion. It's communities. It's connected, and this whole world just is available to sort of sort your way through it. And so if anybody ever asks me about social media, this is always the first slide that I see. And I give credit to the file location, and there's a nice blog write-up. If anybody actually wants, just send me a after I spent a couple weeks really getting into Twitter, and I really figured, all right, I'm just a cancer survivor that wants to, and I needed a strategy to stay organized. I set up one account on Twitter and started interacting with other cancer survivors. I found a ton of people online. Through Twitter, I learned about how people were setting up Facebook pages or groups around disease-specific issues. So if you go, it's amazing, if you go into Facebook and search for a healthcare condition or some sort of disease profile, chances are there's a lot of groups that are already out there, a lot of people interacting on Facebook. I found a ton of new cancer survivor friends through different Facebook pages, and to me that's been that's been a little bit of a surprise. I never thought that I'd really find a lot of I don't want to say valuable information, but I always assumed Facebook was just a fun place to interact with your friends or old high school friends or something along those lines, and for me it's been much more. The other surprise to me has been on LinkedIn. I've gone into LinkedIn and been surprised when I search on Hodgkin's disease or breast cancer, the number of health-related groups that are out there. And you know, I had a couple people push back on this one time when I suggested they look at LinkedIn for a specific disease, and they said, well, I'm signed up for healthcare marketing or healthcare public relations. I said I'm not signed up for marketing. I'm actually signed up as a breast cancer survivor. I'm in a breast cancer group. I'm in a Hodgkin's disease survivor group, and they're not. It's not people looking for jobs. It's people looking to make yet another connection in terms of a shared disease or a shared health experience. Once I really worked on those three areas, I began looking into Meetup, which I found pretty interesting because very similar to the searches that I did in Twitter, Facebook, and LinkedIn, I repeated those searches in Meetup and was really surprised at the number of active groups that were already out there, especially in the Boston area, around different conditions. There's the Hodgkin's group, there's lung cancer survivors group, and to me it was just another way of interacting. So you you create your own strategy, that your own way of looking at things online, you'll be able to really make some connections that you might need. And I just want to share a quick Twitter story that I have for you. But a couple months ago, a friend came to me and said she'd been dealing with some really severe side effects from her Hodgkin's disease treatment. She was actually getting mouth sores from one of the chemos. I think it was a combination of the chemo and radiation that she had. She was developing really bad mouth sores. And she said, you know, did you experience the same thing? And I said, yeah, but my doctors had prescribed a mouthwash, or like a lidocaine or something to numb the mouth while you were eating and drinking that would sort of manage those side effects. And her doctors had tried everything for her. And I said, you know, why don't we just put this question out on Twitter? Has anybody else dealt with, you know, mouth sores from chemo radiation, and what was your solution? And we watched. I was amazed at the number of times that single tweet was passed along the network. And about a day later, she had 20 different really solid suggestions on what to do with this situation that she was in. And it was amazing because she tried a simple mouthwash that somebody had suggested for her, and it took care of it. And just, to me, that she had nowhere else to go. She had talked to her doctor, she had talked to the nurses at the hospital that she was dealing with, she had tried to connect with friends, and within 24 hours of putting the question out on Twitter, we had more connections and more interactions and more responses than we could deal with. And for her, it turned out to be a success story. And when I see something like that happen, I begin to think there's a lot of other stories like this, that, or a lot of other questions that haven't been answered yet, that people are still walking around with. And this is a great avenue for people to begin exploring in terms of this networking for health advocacy. Now, I developed an online strategy, realized that that was going very, very well, and started taking my online activism and moving it offline. So I almost started thinking, if I have an online strategy, I've got to start offline. I got to take this to the next level. And it's off the internet and just keep going with people that I can meet one-on-one. And I set up a meetup group. I started looking for other people to network with in the breast cancer area in Boston. I couldn't find anything that fit into that scheme for me, so I started my own group. And to me, that's one of the great ideas of this, having these online connections. You can create an online group, an online meetup, but you're setting a time to meet up in person, offline. And if you go to meetup.com now and you type in Boston Breast Cancer Survivors, my group is there. We have about 10 people in the group now. I've met a few of the people already, and I would have had no way of connecting with them if it weren't through the original online avenue, but we've now met in person. And to me, that just expands the reach, expands the connections that we can have, not only in the online but offline world. I've attended WEGO Health's first health activist meetup, and I was just overwhelmed at the incredible energy that everybody brought to that meetup. And it just, to me, it reinforced that we have to have more people working together, not only in an online realm, but in offline realms. I still call the local hospitals in my area, and I try to do as much as I can to volunteer or reach out and do as much as I can in terms of patient advocacy. And that is a challenge, because hospitals try to sort of their own little silos within communities sometimes, and that to me has been a challenge. But as I meet other cancer survivors in the offline world, it makes it easier, because we're finding that we have a lot of overlap in terms of the doctors that we see, and the different programs that we already take advantage of in the area. So it's really worked. It just flows very, very well. So just a quick lessons learned overview for online activism for me. social media, as much as I love Twitter and Facebook and LinkedIn, it's not a field of dreams. It's not you just build it and people show up. You have to really do some work to keep these things going. And I'm finding that content is really the best way to connect. If you're, and it really will make or break a strategy. If you're consistent with your content and you keep moving forward, investigating what's out there in terms of your health-specific condition or whatever you're trying to do in terms of activism around the health community, the best way to do it is having the freshest content, doing as much as you can to keep talking about what's relevant and keep moving that forward. And for me, social media plus effort plus all the time that you can give it is really, to me, that's social networking. And social networking is the way that you can begin connecting with these communities. The best thing about the online activism, if needed, people can remain anonymous. One thing that I've learned in the time that I've, as a health activist, is some people don't want to share their information about their health situation or their cancer. You know, if they're dealing with a serious illness, that sometimes people feel comfortable if they can remain anonymous behind an anonymous avatar or an anonymous profile of some sort. The people will reach out, they'll interact with you, but they want to do it on an anonymous basis. And you know what? That's okay. And for some people, that's going to help them. And you can interact with them if you have to online and do what you can. But if they want to remain anonymous, that's really all right. Don't force the connections. Don't try to. You can't build a relationship just by linking or you know, following somebody on Twitter or Facebook or any of these other social platforms. Don't force it. Just let things develop naturally, and time is on your side in that regard. I mean, the more time that you spend in social media or social networking, the more that these relationships will grow. Okay, offline activism. Another thing that I've found very surprising is there's a lot of health activists that have yet to establish identities online. I really ran into that situation a couple weeks ago. I attended the Project Lead educational series here in Boston from the National Breast Cancer Coalition, and it was a room of 500 people that were there to learn as much as they can about breast cancer, and it was doctors and nurses and researchers and health advocates and survivors, and I think maybe 10% of that room were active in online or online communities, and I was really surprised by that. And it's something that it just, you have to still respect that some people haven't hit the online curve quite yet. So there's quite a few offline communities that still can be tapped into, that you can still connect with. And you've got to reach out to these other activists that aren't necessarily hyper-connected. And to me, that's been a challenge because I'm wired all the time on Twitter or Facebook, and it's been good. It's been a good exercise for me to learn there's other ways of networking instead of online. And by going to conferences or attending seminars, to me that's been a great way to sort of expand my reach, expand my networking here in the Boston area. And hey, if people don't feel comfortable meeting us, you can keep it on the online area, and that's okay. That's one of the big lessons I've learned. Final thoughts. I guess I must have really sped through that in about a half an hour. But so a combination of online and offline activism really provides the greatest return. So you've got to look at both the online and offline world to really make the connections that you need. And I guess at this point, I guess I'll ask Amanda and Susan if they've taken any questions from anybody.
Yeah, you've given us so much to think about, and we have some great questions here. Hopefully you can field a few of these. This is a good one to start with. Did you ever struggle with finding honest, good organizations or communities? There are so many. How can I find the right one?
Actually, that's a great question because, and I'm gonna, if I may, whoops. Hi everybody, that's my desktop. I'm gonna go back to this social media explosion slide. Because I think this question really speaks to this directly, the idea of, you know, where do you feel comfortable, or almost how many communities are too many communities. And if you look at the slide, I mean, where do you dig in or where do you start? When I first got going in signing up for these different communities, I went out, and I'll speak from the cancer perspective, I went out and signed up for Planet Cancer, there's a cancer survivors networking group, breast cancer groups. I went out and I basically signed up for them all. I'm Too Young for This, Breast Cancer Foundation, Breast Cancer Coalition, and I tried to interact with them, and I did. I spent a great deal of time in all those different communities, and I really think it comes down to your personal choice. Where do you feel comfortable? I think you can get, the more time that you spend with a community, you can get a good idea of who's there, who's contributing to the community, who's providing content for the community. There are some communities that I found were too negative, and I'm not going to name any names or anything like that, but you get the sense right away when you're in the community if people are the community has to have an attitude. If it's a good, positive attitude, I feel that's where I belong. And there are some communities, unfortunately, that aren't really slated for the positive side. They're very, very negative. And I didn't stay in those communities very long. So if somebody comes to me and says, who should I sign up for, or what group should I sign up with, try them out. Spend some time in them. Interact with some of the members in the community. Check out the discussion boards. See how people are talking to each other, and see if that's where you fit. There's a lot of networks out there right now, and I think over the years you'll start to see some of these smaller networks or networks that aren't able to sustain a positive. And I also look for what kind of resources that they're bringing into the community. So if it's linked from the National Institute of Health or the CDC or some of these bigger name organizations that I do trust, then I feel pretty strongly about where I am. I feel good. I feel like I belong there. So I hope that answers the question. Anything else?
Yeah. How about this one versus those that are rare?
Good question too. I mean, obviously, cancer. If you type in something like cancer, you know, you'll quickly find a lot of organizations out there. I'm trying to think of a rare condition or rare profile that I would think of, but the best way to find these rare kind of organizations is just through, you know, some good old detective work. I think that you know, there's a lot of publicity obviously that goes into a disease profile like breast cancer, and it makes it easier to find communities like that because everybody seems to be talking about it. But in a condition where you know only 15 or 16,000 people are going to be affected, those communities, I know they're out there. It might just take a little bit longer to find them, and you'll probably have to wade through some stuff before you're able to connect with them. But I guess my question is, I'm going to send a question back out to the person that sent that question in. Send me a message or send me a tweet on what you're trying to find, because I'd love to try to help you find it, or find another community, or find an area to start, because that's a very good question. And I don't know that my answer really, I don't know if I can help you with that, but let's see. Anything else?
Yeah, we have some more great ones. All right. What kind of offline meetups do you find work best? Casual, like a social dinner with chatting, or more organized meetings, perhaps with speakers?
That's a good one. I didn't realize what a social person I guess I was until I started attending some of these meetups. But I think if you're establishing a new group and you're meeting with a group for the first time, I actually found that it was easier for me to go into a structured meetup or a structured setting because it sort of takes the pressure off of a new person coming into the group, that there's a little bit of a framework for the evening or the meetup or the conference or whatever it is you might be scheduling. If you give a start time, an end time, and 3 or 4 things that you really want to cover throughout the evening. You don't necessarily have to bring a speaker in, but if you have an agenda for the evening, I found it makes it easier for people to come for the first time or to show up to the event for the first time, especially if they're coming alone. It's hard to meet people for the first time. No matter what you're talking about, it's still hard to meet people face to face. And I find that if you're talking with somebody online and transfer it over to you meet up for the first time in person at an event, it still helps to have some structure around that interaction. And I think it just makes it easier for everybody. But, I hope that answers that question.
Yeah, that's a really good answer. I was wondering about that myself. All right, this is a tough one for you, but it's a great one. Okay. Have you been able to bridge your offline activism into working with legislators? Do you have any tips for cracking into this end of offline activism, and have you found ways to connect this online as well?
Wow, that was a fastball. Actually, that brings up a very good point that I personally struggled with before I grabbed onto the health activist title. I guess I came into this, over a year ago now, I'd say, and I thought activism, you had to be politically active. And I guess I just want to clear that up before I answer the question. And we've had a couple of these conversations on WEGO Health before. Do you have to be political, or does your activism have to be political to make a point? And I would argue that no. You don't have to be political to be an activist, because activism comes in so many different forms. But to address the question that's on the table, the idea of taking that offline activism and learning how to become political, or how to take it to the next level where you're actually lobbying for change or trying to change legislation for a healthcare condition or a healthcare setting. To me, that's the point I'm at right now. So I was very excited that I attended the conference, the National Breast Cancer Coalition conference, a couple weeks ago, because that was one of the topics that they actually addressed. And it's they had suggestions on how to reach out, learn how to write a letter to your congressman, or learn how to stay in tune with what's going on in Capitol Hill. And I'm just beginning that experience, and I guess that could possibly be some subjects that I cover over the next few weeks as I learn about it. But I haven't gotten to that point, but to me that's a natural extension of where I need to go. And hopefully over the next few weeks as I learn that, I will definitely share that with you. So I guess I'll leave it at that for now.
Okay. How can you get started when you're trying to organize your own meetup locally in your own area?
Let's see, how would I get started? I would go to meetup.com, I guess, for starters, and look to see if there's a similar group or a similar topic being covered in my area. If there is, I would certainly join that group to get started. And if you live in an area where you feel like a topic isn't being addressed, start a meetup group. When I started my meetup group was up for, I'd say, almost 2 months before I actually had a member join, and you would have thought I hit the lottery the day that the first person signed up, because I was just so excited. But I didn't spend any, there was absolutely no financial backing for what I did. All I did was throw up a page on meetup.com. I publicized it through Facebook. I publicized it through Twitter. And then I actually put a connection on LinkedIn. And I think I was actually watching the how people were finding the breast cancer link, or the breast cancer meetup link, and it was actually coming from connections I had on LinkedIn. I would do it that way. I would publicize it across your social networking platform, or across the little strategy that you write up for yourself. And then I would also start looking for other people, not necessarily online but offline, to see it. Call your local YWCA or YMCA, or your local, your gym or something, where some of these communities that or some of these smaller communities that have some of those kinds of resources, pick up the phone, call them, and say, hey, I want to hold a meetup at your location, or call up a local hotel and say, I want to bring 10 people over for a networking night. And you'll be surprised at how often people really want to help or want to get involved in it. And they might have nothing to do with cancer, the healthcare space, or whatever, but they're willing to reach out a hand and give you, to help you out. And that, to me, is the way that communities really get started. So, next question. How about that?
Let's see here. How do you start to connect with people who have different health conditions? Is it easier or harder to relate across condition lines, and how do you bridge gaps?
That's a very good question, because I think, to be a successful activist or advocate, you can't just stay you can't stay sort of siloed or sort of walled off in your own community. Like I'll never be an effective advocate or activist if all I do is ever focus on Hodgkin's disease or breast cancer. I've learned a great deal by connecting with other people on WEGO Health, just in terms of the different disease profiles. I've learned quite a bit about diabetes, sickle cell. I mean, things that I never really thought about, but I've learned a great deal from watching how these other communities interact. I've learned how to, in some cases, I watch how, I think my new friend Phyllis from Atlanta, the sickle cell warrior, watching her interact with her group, I've learned how to turn around and sort of network and talk to my cancer community. And it's just from following other communities and learning what I can about what does it mean to really to deal with diabetes, or or asthma, or pick any health condition. After 18 or 19 years of living a life that's primarily dealt with cancer, it's eye-opening for me to turn around and see what goes on in some of these other healthcare, or these health-specific profiles, and it helps me connect with people. It makes me more compassionate about what's really going on out there in the world that's not necessarily affected by cancer. I hope that helps.
Okay, here's a good one. Do you ever experience conflict between organizations or groups, online versus offline?
Yeah, definitely. You know, I've had a couple cases where I've dealt with some organizations that don't want to have anything to do with the online world, and I think that that makes it hard. You know, to me, I see no difference between interacting online and offline, but there are some cases where it just doesn't. That kind of it gets lost in translation, I guess, if you will, trying to take an offline group and sometimes merge it with your online interactions. But that is it can happen. I know that. I don't know if that actually answers the question, but in terms of conflicts, they're always there. I mean, no matter, you're going to have conflicts within a community, across communities. It's how you manage it that really speaks volumes to what you're doing. So I think that answered it.
Okay, here's a great last question.
Okay.
What are 3 things that you would recommend someone who wants to expand their activism?
3 things. Oh, wow. Let's see. I guess what I'll do is share a little bit of a story on how I really got going with this. When I grew up in Western New York in the 70s and 80s, I mean, some of you out there in the webinar land might have heard of Love Canal, which was right outside of Buffalo, New York. And I grew up in Western New York. And as a kid, I remember seeing, I think it was Louise Gibbs, and I'm embarrassed that I can't think of the name. This woman was on TV all the time, just doing what she could to bring awareness to the situation, and it was a very acute situation that was going on at Love Canal in the 70s and 80s. And essentially what it was is that there was a school built on top of a toxic waste situation, and children were getting sick very, very quickly, and very, very sick. And I remember watching nightly news as a kid, watching this woman on TV trying to affect change and bring about change for this community and try to take care of these kids that had been sick and wronged in so many ways. And over the years, what I've done is read a lot about how she went about doing her, or how she got going in activism. I mean, I would read as much as you can. I guess that would be the first thing. Read as much as you can about what community you want to be an activist in. So learn as much as you can about the situation. If it's cancer, if it's diabetes, if it's, you know, pick your topic. Learn as much as you can about it. Find out who the key players are, and read Silent Spring. I think it's by Rachel Carlson. I'm not sure, but I'll make sure to put up a blog post with these names so you can go research some of these people. Learn about what got them excited, where they found their passion, and what drove them to take on activism. You're reading essentially about leaders. I mean, these people exhibit incredible leadership qualities. So I guess the second step would be read leadership. Learn what you can about leadership, being what you can in terms of role model. I'm far from being a leader, and in any moment I have of free time, which is not a lot these days, I read as much as I can about leadership, qualities of leaders. To me, that's very, very important. So let's see, I've got 1 is read as much as you can about your condition. 2, read about being a leader, leadership. And 3, I guess 3 would just be just do it, I guess. Borrow that from Nike, I guess. Just do it. Just get going with it. You gotta walk before you can run, kind of deal. But don't be afraid to fall, because when you're an activist or you're an advocate, people are there by your side to help you, pick you right back up and get you back into the game. So don't be afraid. Just start going, start doing it, start writing about it. And you find out what your passion is very quickly when you sort of read through who these people are in that community, do as much as you can for leadership, and then just try to put it into action as soon as you can. I guess that would be the way I do it. I'm doing it. I don't know. So. That's it.
Well, those are great and doable. And I just thank you so much for sharing your story, Alicia. I know I appreciated it, and I know people out there in webinar land also appreciated it. So thank you to everyone. Be sure to check out all of the WEGO Health events on our events page. And let us know if you're interested in hosting your own webinar. Thank you, and have a great night.
Thanks, everybody.